Welcome, welcome. Thank you for joining us for this special event presented by Word in Black. Over the next hour or so, we're going to dive into the realities of organ donation. We don't necessarily talk about it enough in the Black community, and for many people, it can be a matter of life or death, literally. So, today, we're going to hear firsthand stories from organ donation recipients. We're going to talk about policies and systems for organ donation and the disparities that we've uncovered during our research and reporting. And we encourage you to share your comments. We want this to be interactive. Share your comments and questions wherever you're watching this event so that we can answer them towards the end of the program. I'm Shernay Williams. I'm the multimedia journalist at Word in Black, and I'll be your host today. And a quick plug for Word in Black. We're a national newsroom and research lab rooted in the legacy of the Black press. Our goal is to inform, amplify, and mobilize Black America. And this conversation is a culmination of a multi-part reporting series launched by our health data reporter, Anissa Durham, and it's called On Borrowed Time. And I'm going to invite Anissa to come speak with us now, as well as our Insights and Research Director, Dr. Krista Malobo. How are you, ladies?
Good. Thanks for having me.
Great,
Doing
great,
well.
great. So, Anissa, we have to start with you, right? Because you had the vision that brought us all here today to have this conversation about organ donation within the Black community. So let's start with that. What made you decide that you wanted to focus on this topic and dedicate a year of your life to this reporting?
Yeah, thanks for the introduction and thanks for the question. I have been really interested in organ donation for a few years. Something that I've shared kind of throughout this process is I was renewing my driver's license a few years ago, and I happened to, be with a friend who worked at the hospital, a Black woman. And I had just asked her, like, do you think I should register as a donor? And she very explicitly told me, don't do it. They're going to let you die. I know how they treat patients. So then I thought, oh my goodness, no one in my family has ever talked about organ donation. Nobody in my friend group had talked about it. So I started bringing it up in conversation with some of my other Black and Brown friends. And this was just kind of a general consensus. So I've wanted to report on this for several years. I wasn't finding the right people to talk to. But after a while I did, thankfully, and then I was able to talk to some other folks that, we'll bring on later, to share their story dealing with chronic disease and needing an organ transplant. So it's been a really interesting process. I think you're on mute, Shernay. Shernay, you're on mute.
Thank you. So the outcome has been eight, soon to be nine stories, right? And of course, the audience can read those on wordinblack.com. And you have some multimedia elements as well, video, audio, and I know original research was also a huge part of it. So I want to bring in Dr. Krista to talk about how that played a role in the reporting as well.
Absolutely. I'm so thankful and inspired by Anissa's stories. It really helped shape a lot of the questions that we wanted to add to this research. So I'll say in general, as a social scientist, I think that centering real voices and experiences by asking both open-ended, so qualitative, and then some closed-ended survey questions are really valuable. I think it's a way to really get nuanced answers about things like trust and knowledge and intentions and decision making around a topic like organ donation. So the first survey that the Word in Black Insights and Research Division ran was of nearly 1,600 Black Americans around organ donation attitudes, intentions, beliefs, alongside Anissa's editorial pieces. And what we found was that a lot of the data from the study backed up some of what Anissa was finding in her conversations with OPOs and with recipients and with folks that are on the waiting list. And it uncovered a lot of really interesting things that some we already knew, and then other things were sort of brought to light from the data. So excited to chat about that a little bit later.
Yes, absolutely. I actually want to hear about it now. What's like one nugget that was very interesting and important for us to hear?
Absolutely. I think one of the big things was that there was a lot of misunderstanding about the organ donation process, which we think in part is what is contributing to this mistrust. Maybe even some of the myths and conspiracies that that a lot of folks, think about or talk about. So in our study, for example, we found that as many as 1 in 4 individuals who took our survey worried that doctors might not try as hard to save their life if they're listed as an organ donor on their driver's license, like Anissa was just saying. We also found that more than 50% agreed or strongly agreed that there was potentially a black market for organ donation. And then 75% of respondents, this was the most highly endorsed belief, but they either agreed or strongly agreed that the rich and famous essentially get to jump the list and receive priority in the organ donation process. So there were just a lot of really strong feelings, I think I'd say, around organ donation. And some myths that we hope through this series were able to dispel.
Right. And Anissa, I know that you talked about that a lot in your most recent article and video that came out. I believe it was yesterday. And, you talked about that elephant in the room, right? Why Black folks are not becoming organ donors. So can you share a little bit about what you have what you learned as well during your reporting?
Yeah, for sure. So as Dr. Malobo was mentioning, a lot of people's fear around organ donation is partly because it is a very complicated, complex system, and a lot of people don't. What you don't understand, it's easy to have misinformation around that. But there's just a lot of mistrust of the healthcare system. There's the historical factors that we know of, the Tuskegee syphilis experiment, Henrietta Lacks, but then you have the modern day examples. You have the experiences that people are experiencing right now in real time, where they're having these um, situations with doctors and physicians where they're being misdiagnosed or ignored. I mean, very recently, the viral video of the black woman who was in labor and just completely ignored by a nurse that's sitting right next to her. So, these types of experiences create a lot of fear about a system that most people don't understand. And one of the things that came up from one of the experts in the story, she told me that even though people might understand the system or they might, be able to conceptualize how things work, how the process works, they still don't feel the need to register. They don't feel the need to give back into a system that hasn't necessarily given to them. So it's very interesting. I do think that we don't want to assume that just because people have this fear or this mistrust that they'll never register as a donor or they can't do anything with that feeling. But yeah, it begs a lot of questions about how you move forward through this.
Right. And the importance of it too, right? Because we have these fears some people have. You're balancing mistrust, but at the same time, we need organ donors, right? So can you talk about why it is important for there to be a nice amount of people in the community contributing to this?
Yeah, so one thing just to kind of level set, most people will not be an organ donor. The majority of organs come from deceased donors. And even, for those of us that have checked yes, most people do not die in a way that would even warrant them to be a donor. So just to kind of explain the process, you have to like die in a hospital, be connected to oxygen, have your blood flowing. They have to run dozens of tests to make sure that your organs are even viable to be used in, for somebody else. But, people that die at home or in a car accident or the majority of other circumstances will not even qualify as a donor. So that's just one piece of information to kind of address this myth that, if you're gonna die, like they're just gonna snatch your organs because it's just not true. And I'm sorry, I forgot what your question was. What do
Oh,
we
no,
need to
no, because I was going to ask about the actual process, right? I was going to ask you, so, I say I want to be an organ donor. What is that process? So you explain that for us. But my other question was really about why should they, right? So why should I say yes on the driver's license?
Yeah. So Black folks have some of the highest rates of, end stage renal failure, kidney disease, diabetes, obesity, some of these conditions that lead to a need for organs. But at the same time, more of us should register as donors because we're more likely to match with somebody from our same or similar racial and ethnic background. So it's more likely to match, it's more likely to be successful if, my organ is transplanted into somebody else that has a similar makeup. Um, and generally it's just it's important. I mean, it's life saving, which is why I've wanted to kind of explain this process and address the misinformation, because it does save lives, and it does save the lives of the people in our community who look like us.
And I know one of your goals too was to talk about the policies and systems that are at play when it comes to organ donation as well. So what have you found?
Yeah. So there's definitely a lot of disparity. There's a lot of inequity in who gets access to care, just generally in healthcare. But one of the things that I focused on in the first story that came out that will feature one of the sources that we're going to hear from later on, it's called The Cruelest Kind of Heartbreak. And it kind of details how the One Big Beautiful Bill Act that the Trump administration passed earlier this summer is essentially gutting access to Medicaid and other, forms of health insurance. And the majority of patients that are in some type of organ failure rely on these government assisted programs. So when you have these cuts to Medicaid, um, less people are going to be able to get on the wait list. And if you have no health insurance, you will not be getting an organ. Um, which is ironic because if you don't have health insurance and, like I mentioned earlier, you die in the hospital, you're connected to oxygen and your blood is flowing, you can still be an organ donor if you're uninsured, but you can't receive an organ transplant if you're uninsured. So there's that big barrier and inequity there that definitely needs to be addressed.
Absolutely. And I have one more question for you, Anissa. But before that, Dr. Krista, anything else you want to say about the whole process of running the research phase of the project?
Yeah, I think one of the biggest things that stood out was this idea that racism in medicine really continues to impact our community in ways that spill over into the organ donation process. So, something that came up in the survey was that a lot of Black patients didn't feel like they were, or Black folks in general, when we visit the hospital, didn't feel like we were treated with a sense of dignity and access potentially in the organ donation system. So over half of the people that responded felt that Black patients weren't treated with the same dignity as others. And then 72% didn't believe that Black patients received the same access to transplant evaluations and waitlist placements as other patients. So speaking to what Anissa was saying earlier, I think it's really hard to get a community involved when they feel like, in general, a healthcare system does not have their best interests at heart. But as Anissa did mention earlier, this work is incredibly life changing and life saving, and we'll hear from some folks later that will speak personally to that. But one other thing that I really wanted to emphasize was that the data did show that the community is willing to participate, but there are questions that folks need clarity on. So we did ask the qualitative question: if you could ask a healthcare provider or a recipient or someone who is registered to donate one question, what would you ask? And there were so many small questions that I felt like could be answered. And I think by continuing to have conversations like this, we're going to be able to give the community more clarity. But for example, some folks asked, am I too old to donate? Or they wanted to hear more from a recipient what their journey looked like and how many anti-rejection meds you have to take and what are the pros and cons and what's the healing process like, and safety and ethics, like is the process safe? So there are a lot of questions that sort of still need answers from the community. And I hope that we're able to highlight some of that today. I think Anissa highlighted some of that in her stories, and some of that will also come out in the report that's coming out of this survey. So thank you.
Absolutely. That's why we're here. And of course, if you have questions right now, drop them in the comments, because we're going to leave at least 15 minutes towards the end of this program for you to ask any questions that you have, or I will relay your questions to the guests. And Anissa, just bringing it back to you, I mean, this has been a year-long project, and I'm always curious to hear about people's process. You know, what was the process like in finding the people? You mentioned before it took some time to get those relationships going, but just give us a little sneak peek of what it was like for you.
Yeah, I think one of the biggest hurdles, which is why it took so many years to get this project off the ground, was finding the right sources. Thankfully, after doing health reporting after 2.5, 3 years, I had built up a Rolodex of sources, and I was able to get in touch with people that were more close to this topic. So once I got into the right room, it was very easy to get more sources and to get more people on the record. But I just, to be a little more detailed, I guess one of the things that I do to keep myself organized is I have a spreadsheet, and I, was keeping track of everybody that, is a transplant surgeon, works at an OPO, has a lived experience, just to kind of organize and see who makes the most sense to talk to, who can put me in touch with somebody else. I also use social media to find people. At one point, I think we even did a call out in our newsletter. So, it was a multifactorial effort to find the right people to talk to. And I really tried to do interviews very early on. I wanted to see, I have my questions and I have my thoughts about what this series could look like, but I think the people that are living it, the people that have received a transplant, are on the wait list in need of a transplant, like they're the voices of this story. They're the voices of this narrative. And what do they feel like is the most important piece for me to be paying attention to? So originally this was going to be like 3 to 5 stories, and it's turned into almost 9 stories, which, shows how much information I was getting. But it's been truly an honor to hear so many stories and just the voices that people, they've trusted me with.
And that's a perfect segue into the next part of this. And those are the stories, right? So we have two individuals from Anissa's stories here to speak with us. I'm going to bring on Craig Merritt now, who had a kidney transplant in 2023. How are you doing, Craig?
I'm doing well.
Thank you for being here.
Thank you for having me.
Yes, and you've been vocal about your experience with kidney disease. In fact, you have a podcast where you're talking about this. You're the executive director of the Get in Position Foundation, which has that mission to empower people with kidney disease. So, first, can you just take us back to when you first learned that you had kidney failure?
Sure. I was diagnosed in 2000 in the spring, and it was a routine doctor's, not routine, but I was getting over a cold. I couldn't get rid of the cold. It was sort of like a head cold, and I was having, nasal issues. I couldn't breathe, and I went to the doctor. And of course, they take all your vitals in the beginning. The nurse takes your vitals in the beginning, and my blood pressure was running very high, and it became a huge concern to the nurse. She kept taking the vitals, going out of the room, leaving, wanting me to relax. She took it in the other arm. The numbers were running very, very high. She had concerns. I had concerns. She kept asking me, how do you feel? Do you feel all right? You feel okay? I was like, yeah. And so I'm like, what's the problem? I didn't understand what was going on. I was 29 at the time. And she told me that my blood pressures were running extremely high, and that was a concern. Me being a young man at the time, and I seemed to her, I looked like a healthy young man. And so she alerted the doctor. Um, and when he came in, he took my blood pressure once again. and it was extremely high. Again, it just wouldn't come down. And so that alerted him, and he immediately says, okay, I need to refer you to a nephrologist. And I'm like, wait a minute, hold up, time out. What does, who is that? What does that mean? Why? I'm here about, I can't breathe. I'm congested. So why do I need to see a specialist at this point? And a specialist whom I've never heard of and don't know what they do. And he explained it to me that a nephrologist is a kidney specialist. I said, okay, what does my kidneys have to do with my nasal passage, which is clogged right now? So, long story short, he says that's when I learned that your kidneys actually regulate your blood pressure. And it grew concern for him at the time. And I say I was kind of fortunate because, you know, the things that was spoken of earlier uh, from Anissa and Dr. Krista about, you know, individuals not feeling treated, or African Americans, Black people not feel, you know, treated right or fairly. I was fortunate in that situation. So it raised the flag for him and sent me right over to a nephrologist where they did a kidney biopsy and discovered that I had scarring on the kidney, on the tissue of the kidney, which was, I was diagnosed FSGS. That's a rare kidney disease. Has a long name. We won't get into that. I won't fumble over that today. But it's an acronym, FSGS, and I was diagnosed at a stage 3. And at that time in 2000, it was just stage 3 because there's 5 stages of chronic kidney disease. And today it's split out. 3 is split out to 3A and 3B, based on your EGFR and your creatinine numbers. So, but that's when I was diagnosed.
And that must have been so jarring. Like you said, you just thought you had a cold and congestion, but it's a blessing that you had that medical team that was on top of it. But then you had to wait for a kidney, right? And so you got a kidney in 2023, but it wasn't easy for you. And you've also brought attention to this calculation that doctors use to determine who should be placed higher on the transplant list, and it was
Absolutely.
based on race. And so, can you tell us about that?
Yes. So before waiting on the kidney, one of the things, and you just mentioned it, and again, I will repeat this for the viewers out there. I was, in my particular case, I was very fortunate, and I do understand that there are individuals who are not so fortunate as I was, because when I was diagnosed on stage 3, I stayed on stage 3 for 18 years. So waiting on the kidney was not even in the mindset at the time. It was prolonging that stage 3. I know for some individuals, when they do discover and find out that they have been diagnosed, it's gone far too long, meaning that they're already in end stage. So my end stage didn't come until 2018. So that my waiting for a kidney was actually 4 years. But nonetheless, the EGFR calculation was always something that I questioned, because I was taught by my nephrologist. Again, I was fortunate. I was always taught by my nephrologist to understand my labs, learn how to read them. She taught me how to read my labs and understand my labs. I'm also doing 2 things here today. Hopefully the viewers are learning. You gotta understand your numbers, right? We're patients. Yes, we get over the fact that we've been diagnosed. Okay, I got this thing. It doesn't have me, so I got to deal with it. right? So we got to educate ourselves, or get someone to educate us. So I always learned how to read my numbers, and my nephrologist made sure of that. And so I always questioned her as it relates to these two numbers, because there was a EGFR. Then right underneath that, it was, if you're African American, EGFR, then the number. So I would always question it because it didn't sit right in my spirit. So I would question my doctor. I said, what does this mean? And her only answer to me was, that's just the way it's calculated, and we have to go by that. So I was like, okay, all right. So I kind of went along with it. And not until we fast forward 2019, I'm on dialysis now. So now I reached the stage 5, end stage renal failure. So now I'm on dialysis, which I hate. I cannot stand it. I despise dialysis. I hate it for anyone who has to go on dialysis. And so I'm learning. So the way that my brain works is, okay, I got this thing. Now I got to get off of this thing, because we not doing this for forever. I've heard the stories. And if we back up a bit, my father-in-law, prior to me going on dialysis, my wife and I was his caretaker. He was on dialysis. So I was taking him back and forth to treatments. So I was getting a glimpse of where I was going. And I said, hey, nope, not me. All right, we're going to do this thing. We're going to fight it. So I'm getting evaluated at transplant facilities. And in fact, my nephrologist, she was very proactive because she knew where it was going. Because FSGS, you can just Google it, people. Just Google it, FSGS. It'll come up, tell you what it is. That disease progresses. As I aged, it progresses. So dialysis, I was always told dialysis is inevitable. That's where you're going, because there's no cure to chronic kidney disease after kidney failure. There's no cure for it. It's just treatments. So I'm going through evaluations, and I was told by a social worker, Craig, better your chances to receive a kidney transplant by getting evaluated at multiple facilities. A lot of people don't think that you can get on several different lists. Just as long as you're in a 4 to 5 hour radius that you can get. Once you get the call, you can get there. Because once you get the call, it's a go. So as I'm going along, I'm hearing this thing, EGFR, EGFR, EGFR. Okay. Then I receive a letter from one of the transplant facilities I was listed. I was listed at on three lists, and I was working on my fourth when I received the call for a transplant. And I received a letter stating that the policy changed. I'm like, policy? What policy? So it was explained in this letter that they didn't say racially biased in the letter. They just said they did away with it. The policy changed. And as I dug deeper and asked more questions to my medical team or my healthcare providers who I partnered with, they told me the behind the scenes and what was going on. And then once I received the transplant, then that's when the calls were coming in to say, hey, we're looking for, because that year, January 3rd, I believe it was, of 2023, that was the year that the policy actually changed. And it was implemented that every transplant facility had to go back in and readjust. It was mandatory, readjust everyone's time who had been waiting for a transplant. And I actually got a call uh, about that from my transplant facility. They called me on a Friday and said, Mr. Merritt, because of the policy change of the EGFR calculation, every facility has been mandated to readjust everyone's time. We see that you've been waiting for 4 years. Your time has doubled to 8.
And
And
you were fortunate, but that means that so many Black people didn't
that's
get
what
that benefit, right? Because they were lower on the
exactly
list.
exactly that's what I'm getting at. That's what I'm getting at. And to kind of end that story on, I got that call on a Friday. On Sunday, I got the call for the kidney. So with that said, because of that racially biased calculation, what it was doing, it was stating that if you were African American, meaning, and I'm not sure, I doubt if they do the blood work that they test, is this a Black person or a white person? I doubt that they do that, right? So it's what I checked on my application. Are you African American? Yes, I'm proud to be. Yeah, I don't say other. No, no, yes, I am. So because you check that box, all right, the calculation, what it's doing is stating that African Americans, Black people, your kidney functions is doing much better than your white counterparts. So you don't need dialysis right now. Based upon this number, you do not need dialysis right now, which you do. You don't need a transplant right now, or, you don't need it right now. You can wait, which a lot of individuals needed it right then and there.
Right. They didn't get it.
They
Wow.
didn't get it. They didn't get it.
And I'm curious because, at the top we were talking to Anissa and Dr. Krista about, misinformation and hesitancy, right? And I'm curious because you were 29 when
Mhm.
this journey started for you. But prior to this, what were your views on organ donation?
I didn't have any. I'm 29.
Yeah,
I'm 29.
right,
I want to wild out. I'm a young man, whatever I'm doing. And that too led up to the damage of my kidneys. So I'm not thinking about that. I'm young. I got my whole life. What is that? What is your whole life? I only have that day. That's all we have, right? Today.
that's
So
all
you
you
don't know
have,
that when you're 29.
right? So, what do you think we can do to help more people understand the value of organ donation and maybe even earlier, right?
hmm Well, one of the things is this word in black. Let's start there. Word in black, right?
I
Let's
like that.
share it. Let's share it. People viewing, share this link. Put it out there, because one of the things we're sharing is education. My people perish for a lack of knowledge. And that is so true, because we don't know. It's more education. And this is one of the reasons why I founded and started the Get in Position Foundation. It's because it's one of the things is I'm giving my mentees what I wish I had when I was on dialysis. Didn't know, didn't have anyone to walk me through, didn't have anyone to know what it feels like. And about organ donation, it's education. Anissa said something early on. It's about understanding that process. Not many of us African American understand the process culturally. Oh, I ain't giving up my no. I'm leaving with what I came with. that's that's the cultural thing. But today, I don't know the specific data on it, but I'm seeing and hearing more and more individuals, black people, even young people, being diagnosed with kidney disease. And it's not until that moment where families are now saying, the black families like, okay, what can we do? What can we do? Now everybody wants to get together. I want to give you my kidney. I want to give it to you. What you need. And so it comes a little bit too late, but we have to do more things like Word in Black, the Get in Position Foundation. We have to get out there more. It's about educating. That's part of our mission statement, empowering individuals with living with kidney disease to take control of their health journey through education. That's the first thing. Counseling is second, and personalized support is the third. So, education is key.
Yes. And what's your website in case people want to visit that?
Oh, absolutely. It's www.getinposition21.org.
Thank you, Craig.
Thank you.
Thank you. Thank you. And of course, you can read more about his story on wordinblack.com as well. And he's just one of the resilient and inspiring voices that we were able to speak with. I want to bring in another one, Brandon Gerard. How are you?
Hey,
Hi,
I am great. How are you?
I'm doing well. Thank you for being so patient.
I was great.
For us
It's been
to
fun.
get to you. But please talk to us about your journey. I understand it's different than Craig's and it's ongoing, right? So please tell us more.
Absolutely. So hey y'all, my name is Brandon. I use they them pronouns. I was diagnosed with congestive heart failure in February of 2024. I had been getting sick, but it felt like allergies. Um, but now, hindsight 2020, there's some things that really stuck out. Um, I was always the person who would dance and cook. I was vegetarian at one point in the gym, but I was just gaining weight. And I remember going to doctors and they're like, oh, whatever, your blood pressure is a little high, but like kind of a disregard. But it got to the point where I was having shortness of breath, and my energy really, really depleted. And it led me to start picking up edema, which is a symptom of that condition. And to the point to where little TMI, medical TMI, everything below became swollen with edema with the fluid that was picked up. Um, and I slowly lost my ability to walk and I became bedridden. I was like, okay, no, I need to go to the hospital. But I had to wait. At the end of 2023 because I was not insured. We love a good job that kind of stiffs you on your health insurance. So I didn't have health insurance even though I was employed. So whenever it did kick in, I went to the doctor, and I thought that it was just gonna be you know, like this is happening, or like something less dramatic than finding out that you have heart failure. But that treatment even then was really tough, even though I was optimistic. It's like, well, at least I kind of believe you have to know the demon to be able to cast them out. Speaking to the education piece that Craig was talking about. uh so I'm like, I know I have this. What's the next step? But Yeah, it was tough. Like I know because of my intersections, I have to advocate for myself anyway. But I did not even know what I didn't know. So it was really, really tough, and it led to another hospitalization at the beginning of this year, which I had to relearn how to walk again. I found out that my heart had fallen to um, 15% performance at one point, but that was also like they didn't do the echo like immediately. So who knows how bad my heart was originally, like whenever I was actually admitted. And yeah, that was a process, but um they because of even the treatment in that hospital stay, they were throwing a lot at me at one point. They were saying that eventually I was gonna need a heart transplant. I was gonna need like implants, like a the flip implant, like all manner of things. And I'm starting to learn that that institution that diagnosed me definitely mishandled me. Um, and I'm not surprised. Like I walk through this life as a hyper marginalized person. So yeah, it's been a lot of learning and advocating and healing, thankfully. But yeah, I'm still in a space where I don't fully know what's going on, the process, the way forward, my the steps towards healing, like the pharmaceutical intervention, the changing of my medication has really dramatically helped my experience. So like, do I need a transplant? Like, so like it's yeah.
Going through it right now. And I want to thank you again for taking the time because I know that you have so much. I can only imagine, right, what you're going through right now over this past year. So thank you again. But you mentioned being hyper marginalized,
Mhm.
and how do you think that's impacted your care?
Oh, tuh. Shout out to real quick to Dr. Kimberly Crenshaw, the intersectionality of it all. Like I know that I am black. I am also fat. I am also dark skinned. I'm also really feminine. So it really paints a different experience because I am quite literally everything that's wrong. So um, I almost said the doctor's name. Whoop. Uh,
Don't do that.
okay. I had to literally on my hospital bed. I can barely move my limbs. Have to look a doctor in their face and say, "Your bedside manner is awful. Like you are completely disregarding me, and your language is violent." And thankfully, I had that language, but not, I know not everyone has that language and they kind of just take it. And there's a large part that I kind of ate, especially during the hospitalization, because I'm in the hospital for my heart. I can't afford stress or arguing or being mad or like I had to really like hold myself inside of myself and be like, we just got to get to the other side. Um, but even finding out, like I didn't even know into a really amazing friend and advocate. Um, let me know, hey, you're prescribed to lisinopril. You know that's really dangerous for people of African descent to be taking. Me not knowing, I was taking it for a year before my second hospitalization. And it was prescribed by a doctor who didn't see me. And it's like, dude, then every person that I talked to since has been kind of floored. They like, they prescribed you that? Like, like there's certain parts of my experience where I'm getting pieces from others and I'm learning more and more and more. And they're like, no, what you experience is really egregious. And then uh, I already forgot what I was about to say. Never mind.
But
But
no, so it's just like you're not only going through the symptoms and everything, but you also have to be educating yourself on this
Mhm,
disease, as well. And so that's a lot. And then also, how do you manage? Because you mentioned insurance. Maybe we didn't. I think it was maybe Anissa who talked about insurance. But can you talk
mhm.
about what that is like? Because I mean, this is expensive, right, to get care.
Absolutely. So at this point, if it's not paid, like I want to live. Um, I, because of my disability, because of my experience and my healing journey, the days of me hustling in that way, like physically using my body, those days are done. Like I just went to the museum the other day and just walking around in the museum. The next day I was out. So, like even if I needed to like get a retail job, be a retail man, like I can't do that. My body can't afford it. So having to try to find like work from home work in this day and age. And then I'm also an artist. Like there's like one, I just died. So, I don't want to continue to live my life to just work, just to even just have insurance, but of course I need it. So it's been precarious. Like I'm still, I have some medicine. I found some subsidized insurance, but that also comes with a cost. I don't have all of my medications. I'm struggling with starting my care over, and kind of getting a new consensus of what I need because this institution really didn't see me. So it's tough, but hey,
Pulling through.
yeah,
That's what we got to do.
okay.
And I know that you said that the medication has been working, and so now you're
Hmm.
not sure if you would need that transplant.
Hmm.
Um, but what do you say? What do you want people to take from your story and organ donation, anything as a whole? What do
Hmm.
you want them to take from this?
So based off of my particular intercessions, I just want to like say this part because I just remembered it. One of the most powerful experiences, and it came in relationship with a black woman doctor, um, she did the genetic testing, and whenever she read my results, she told me that I had a genetic marker that caused the atrium of my heart to enlarge. So that is what's causing what's going on. So she looked me in the face and said, "There's nothing you could have done to prevent this. Like, it's not because you're fat. It's not because you're black. Like, it's a genetic marker on your heart." So that for me gave me, I guess, the armor I needed and like the refresh I needed to kind of dispel the shame of going to the doctor and they're like, well, you're fat. We can't even treat you because you're fat. But literally, I'm fat because of fluid. Like, I lost over 200 pounds of fluid in 1 month
Wow.
because I was on liquid diuretics the whole month. So imagine that build up over time. So yeah, it's the education piece. Um, really be aware of the systemic issues that face, especially hyper marginalized people, and know that your life has value. And whenever they try to discard you, look them in the face and say, would you treat a white patient in this way? Or I don't like how you're talking to me. So, Yeah, that and building community is huge. Like, if it wasn't for community, I would be dead.
Yeah. Well, thank you so much, Brandon, for sharing your story. And I see that we have lots of comments coming in from people. I want to bring everyone that we've spoken with back to the stage. This has been very powerful conversation for me. I hope it has been for the viewers as well. And while we start to work on those questions, um, okay, there we go. While we start to work on those questions, I want to bring Anissa back uh, and ask you another question too, because you've done 8, right? You've done 8 stories so far. You have a 9th one coming out. What can we expect from this last story?
Yeah. So the last story is about organ procurement organizations and kind of the decertification that they might experience. So just to kind of briefly highlight, there is a lot of oversight of the organ procurement organization. They are the federally mandated organizations that coordinate transplants, organ transplants. They don't have the final say in whether or not a surgeon, puts the organ in someone else's body, but they are kind of like the middleman of matching the organs from one person to the next. But there's been some recent reports about them not doing what they're supposed to be doing, and CMS, the Centers for Medicare and Medicaid Services, is kind of trying to crack down and make sure that they're up to par. So that's the last story. So you can expect that hopefully next week, if not the following.
Yes, yes. And lots of supportive comments I'm reading. People who can relate. My dad had end stage kidney failure. Lucretia said that. Pamela says health disparities will dramatically exacerbate all of these issues now. Education about overall health care is essential. They're counting on our lack of knowledge, distraction, fear, chaos, and confusion. And Denisha says, as a collective, we Black people need to raise our health literacy and become better advocates for ourselves and our loved ones. Definitely hearing that. Everyone is saying thank you. Let me see if we have a question here. Again, my brother shares a similar story, liver transplant survivor. Being your own advocate is critical. This is from Dana. The National Medical Association needs your voice. This is what Pamela said 2 minutes ago. Appreciation. Okay, we have another question, but the first question rather for Anissa. From your reporting, did you find any examples of individuals changing their minds about organ donation once they learned the facts? And what info do you believe convinced them?
Mhm. That's a great question. I do think that's worth a follow up story. The handful of people that I spoke to that were not recipients or were not necessarily on the wait list, they definitely still had some hesitations. There was a few things that people mentioned in their interviews that I, decided to address and clear up. But even then, there's so much confusion and misinformation about this. It was just really critical for me to explain as much as I can for, the person that I'm interviewing, but also the reader, so that they can, find the right education.
Right. Next question. Oh, Chris.
I just wanted to add to that because we did ask a specific question on the survey about what might be some of the strongest motivators that would actually have people sign up to be an organ donor. And our respondents said that they would be more willing to become a donor if a friend or family member needed a transplant. So that was the top answer. If they heard more about organ donation from other Black Americans specifically, or if they saw more health information that features Black donors and Black families. So not the necessarily generic national campaigns, but they wanted to see Black faces in these spaces.
Another question. What is the very first thing someone should do if they find out they're going to need an organ transplant? Whoever would like to answer.
You wanna start, Craig?
um, one of the things that I developed when I was diagnosed, after you get over the first initial shock, okay, take your moment. have your time, right? You got to process it. I don't deny anyone that, and don't let anybody deny you that. If you need time to process it, process it. And that's all that falls under the umbrella of self advocacy, which is number one. And Brandon, I'm glad you brought that up, my brother. I developed this thing that I teach my mentees and other individuals that's coming into the program is the 5 P's of receiving diagnosis. Once you get over that initial shock, you got to proceed. What's the next step? Right? We got to proceed. We got to move on. All right, Doc, you told me that. If you want to take your time to get a second opinion, you have that right. As a patient, we got to understand, Black people, that we have rights as patients. Everybody on the planet, I said this earlier this week, everybody on the planet is a patient. I don't care if you're going for a routine checkup, you're a patient. But you got to understand that you got patient rights. So proceed. Let's go to the next step. Then pursue. You have to pursue information. Let's get that knowledge. One of the things that we don't do is we don't take people with us on appointments. We got to take some people with us on appointments, right? Because we're still processing as the patient, as the diagnosed. We're still processing. So somebody coming with me may have a different question or a different train of thought. So we got to pursue some information. Then we got to weigh the probability. Okay, what's this? What's that? Okay, what if this happened? If we don't know questions to ask, there's some simple questions. What, why, how, when, those things. And then we got to ask the possibility. What are the possibilities here? And will I get well? Is there a cure? What is the treatment? What are the possibilities? And last but not least, the 5th P is prepare. Prepare. I had to prepare myself. All right. I'm at end stage right now. I got to go to dialysis. How do we prepare for that? Who's going to take me? Am I going to take myself? Let me get my team together. Not my healthcare team, but my team. Team Merit, right? Get your team together. Is it your spouse? Is it your cousin? Is it your next door neighbor? Is that church member? Who? Prepare. Talk about it, people. Black people, stop hiding what's going on with you. Now, I get it. You can't tell everybody. I get that. You can't tell everybody. But talk to your family. Have a conversation, and I call it crucial conversations. We got to have crucial conversations. One of the things that we don't talk about, we talking about health and all that other stuff. But all of us going to have to leave here one day. Do you have your business in order? Talk about it. Prepare yourself. I'm done.
Yes. Yes, we definitely need that support. And we were talking about Brandon and, self-advocacy. Another question for Brandon. You spoke about having to advocate for yourself with doctors due to your Black and gender fluid identities. How can other Black patients make sure they're advocating for themselves in these medical spaces?
Um, First, I think it kind of starts with knowing that you're worthy of trusting your medical team. Um, I kind of just was like, I just want to be well, and I endured a lot in that space. But it was okay, and it was probably best for me to seek other opinions, and seek other forms of care or a different care team. And as far as moving with like your identities, I don't know about anybody, but as far as me, shout out to the Black Southern woman who raised me to know that if you don't allow shame to control you, if you are comfortable with who you are and honest with who you are, then they can't shame you and control you and diminish you because of your identities. So me being black and fat and queer is no issue. I'm here as a human to get care. And yes, those things do impact my, my medical care, my journey, i.e. the lisinopril, but I'm still deserving of care, of dignity, um of softness. Like, you're not gonna mishandle me just because I'm in this body or I'm in this skin. So yeah, like that's a huge part. And then the last part is absolutely your community. Like, a big thing that I have been learning, still kind of working on, is that hyper independence will kill you. Like, you have to have your community, your circle. And if you don't have anyone, call out, like, seek support, seek community, because it's truly what's going to hold you and keep you here.
And that brings me to a question that I had for Anissa, it's a little bit on that same vein of community, because you spoke with some organizers, right, who are working to not only support people who are going through they're going through the process of getting a transplant, but also to educate people. So can you talk a little bit about people who are helping to kind of change and fight against misinformation?
Yeah, I spoke to a lot of um, educators that are working for organ procurement organizations, and many of them are doing the legwork to educate the community, especially Black and Brown communities, where these conversations and these conspiracies and pieces of misinformation come up. And I think, not for nothing, but education is like powerful. When you have the right information, when you're educated, you know how to make the best informed decisions for yourself. Just piggybacking off of Brandon and Craig, community is so important and it's so critical to your health. I mean, there's so many barriers that we face as Black people, and Brandon talked about their identities and those additional layers. But when we have people to support us, when we have people to back us up that are clear, level-headed, clear-minded, that can advocate and speak up on our behalf, it really, really does make a difference. And even like being the patient, I don't know. I feel a little bit conflicted in encouraging patients to always have to advocate for themselves, because I don't think that you should have to. But with the circumstances that we're living in, it is important to be an advocate of your own health. And that comes with asking the right questions. That comes with not being afraid to say, no, this doesn't work for me. Or one thing that Craig said in his interview, he fired a couple doctors. He was quick to be like, this isn't working, next. And you have that power to do so, because it's your health, it's your body, it's your journey.
And Craig, a question for you. You talked about your fears about being on dialysis for life. How long can someone be on dialysis?
As long as that person's body will hold up. Um, Now, again, here's the disclaimer: I'm not a healthcare professional, but I am an experienced professional. That's how I like to say it. Um, that question has to be asked to a nephrologist, a kidney charge nurse, or something like that. But as far as what I know, is that there are individuals right now who do not wish to have a kidney transplant. Boggles the mind. Um, and some of it is out of fear. One gentleman told me that he has heart issues, and he knows that the surgery will stress his heart out, so he'd rather be on dialysis. But dialysis is rough on the human body. It's really hard and rough on the human body. You talking about snatching blood out, cleaning it, and sending it back in. And there's so many different things that can happen while you're on dialysis. Your blood pressure can drop, the cramping. A lot of people experience that, feeling sick, and also being fatigued. So it's as long as the body can hold out. That's all I could say.
And like you said, no one here is a medical professional, but another question, are individuals with chronic conditions such as diabetes, high blood pressure, are they able to donate organs? To the best of our knowledge, do we know that?
I think it depends. I think if you have diabetes, from the nephrologists and the experts that I've spoken to, you might not be able to donate your kidney, but you might be able to donate like skin or tissue. It really is just an individual case by case basis. And again, the majority of organ transplants come from deceased organ donors. So when you're in the hospital hooked up to oxygen, brain dead, or whatever it is, the doctors there will determine whether or not your organs are usable to be transplanted. I did want to mention, Craig mentioned something earlier about, the importance of like kidney health and all of that. But one of the things I wanted to add is kidneys are one of the organs that can be donated from a live person. So, you know, because of the genetic matching and because it's more compatible from a black person to another black person, that is an opportunity for us to be a living donor to our loved one. But if we're not healthy, if we're not taking care of ourselves, then we won't be able to give our kidney to someone else.
And
Excellent point. Oh, did you have
Char-
something else, Craig?
Charnay, could I add to that? Just
Absolutely.
piggybacking off of Anissa's answer there. I have a real life situation as it relates to donating, having these pre-existing conditions. During my journey, I had a problem actually asking my family to donate. A doctor helped me with that. So, but my brother wanted to donate his kidney to me. Now there is a process as far as, and I believe Anissa talked about that early on, that process. Now, when a family member wants to donate their kidney to a family member that's dealing with kidney disease, they have to go through a process. And my brother had to go through a screening process. And it was just a questionnaire. It was just a simple questionnaire. And one of the questions was, are you currently taking blood pressure medicine or any medication? He listed it. It was just one little simple pill, very low dosage, and they stopped him right there. And what happened was they said you have to consult with your primary care physician prior to this, but we have to stop you right there. And once we never pursued it, because I told him, I said, don't worry about it. Thank you, but don't worry about it. So yes, there are some things that they look at and they take under consideration, as it relates to a living donor. However, there are other programs for individuals, and I can only speak to a kidney, um, as it relates to being a donor, a living donor. Now, you may not, your kidney organ, if you want to be a donor, your kidney organ, you may not be a match, right, to your relative. However, there is a swap program that's in place where you can donate your kidney. It'll go to someone else, but your loved one will immediately get a kidney from a matched donor. So that's something to consider as well as it relates to the education of the donation process.
Thank you. Thank you for that. So I'm going to ask one more question for Anissa, and then if everyone wants to give final notes, we can do that at the end. But for Anissa, From your reporting, did you find any examples of individuals change? Oh, I already asked that question. Why am I reading the same one? There's another one. Okay, here we go. What are your top two takeaways from reporting this series? What needs to change on a systems level and within the Black community?
Mm. Yeah, I think my top two takeaways, just because you have mistrust doesn't mean it's a stopping point. I think you can have both things. You cannot trust the system and still decide, I want to be a donor or I want to help someone else. Um, the other thing I was thinking about is access to care. It's awful in this country. I mean, healthcare access should not be this bad. And I had already done several years of healthcare reporting prior to working on this project, but I didn't realize it is so expensive to get an organ. Like for Brandon, a heart transplant is more than $1 million. And if you don't have health insurance, there's just, you won't even have the opportunity to get on the list. So you're either wealthy and can pay out of pocket for the heart, for the medication, for the surgery, for the anesthesia, like for all the things which the majority of people do not have, or you get health insurance, which the government is, restricting and cutting. Um, what things need to change on a system level? I think we need to have more conversations like we're having now. I think, again, it's so important to be educated about just your personal health care. Make sure, like, preventative care is so important. Let's try to do everything we can to avoid even needing an organ transplant, for one. And then educating yourself about the process, talking to people with lived experience, talking to people that, are like Craig that have gotten their kidney, or like Brandon who, might still need a heart transplant. Those narratives and those experiences add so much value more than what you're going to see on a Facebook post or what you're going to see on Instagram. So that's some of my takeaways.
Yes. And Dana in the comments says, my brother's liver transplant was $890,000 and he had insurance. Whew. So now I want to just take a couple of minutes for everyone to share any final thoughts, notes, nuggets that might have popped up as we were talking that you want to share with the audience. And we can start with Brandon.
Yes. Um, Touching on what you just said, another piece that is really crucial is really talking within your families about your experience, talking within your friend groups about your experience. So to kind of say the whole quote, whenever I spoke with that Black woman doctor that I mentioned earlier, she said there's nothing you could have done to prevent this but knowing sooner, right? And whenever, I got my diagnosis, I'm estranged with my maternal family. But, I talked with them because I was like, this is pretty serious. And one of my relatives was like, oh, I got diagnosed at your age, and your grandmother got diagnosed at your age. So you don't think I should know that. You don't think not just me, but the whole family needs to know that, hey, this is a thing. And now I know, oh, it's not because we fry fish or, eat cornbread. It's a genetic marker like that we carry. Like, we need to make sure that we're doing these screenings as early as possible. And that also comes with a thing because a lot of doctors is like, oh, you don't need that. You're 20, you're whatever. But I had been, I've been pretty plump my whole life. And now I'm like, how much of that has been fluid the whole time?
Right. Dr. Krista, anything else you want to add? Any final thoughts?
Yeah, I just wanted to say that, well, one, I'm so inspired by your stories, and Anissa, again, thank you so much for doing the series. One of the things that came out of the survey that inspired me was this idea that the community is actually willing to help. I think the national averages skew our willingness to participate. So right now, I think only 12.6% of Black Americans are registered to donate, But according to some of what we found in the survey, it's not necessarily because people are like, absolutely not, I never have any sort of intention. It's yes, and I want more information. So I think knowing that with more active campaigns or with more conversations like this, a lot more Black folks are willing to donate is a really exciting feeling that maybe I didn't have before starting to do this research.
Absolutely. And Craig, any final thoughts?
Yes. Just a few things, just to summarize everything. Education is key. Educate yourselves, people. Number two, another big one is self-advocacy is very important. Advocate for yourself. Anissa mentioned in the article, I fired a few. You have the right to do that. And everybody else after that is interviewing. Trust me, they on the interview process. We'll try you out for 90 days, just like they do at work. At your job, 90 days, you get 90 days. You can do that. You had a right to do it. Who told you couldn't? That's how I live my life. Who told me I couldn't do it? So you have rights as a patient. Assemble your team, your community. Assemble your team. And the last thing is get in position as it relates to your health.
Love that. Anissa?
Yeah, I love that, there's a lot of talk about advocating for yourself, which again, I do agree with. But I also don't want to forget that the onus does belong on the healthcare system. I think physicians and people that are in the position to care for patients need to do better. So I'm going to leave that there. Please read the series. I spent a lot of time on it. There's a lot of wonderful voices. You can read about more about Craig and Brandon's story, and yeah, support wordandblack.com.
Absolutely. And so it was important for us here at Word in Black to bring Craig, Brandon, Anissa, Dr. Krista together today because we don't hear enough about what it's like to wait for an organ, to have received one. And these are the people, right, who can benefit from our decisions when it comes to whether we become organ donors or not. And so it is a personal decision. Deciding on how you want your organs to be used, right? And we hope that this was an enlightening conversation. It was for me. I learned a lot. And, not only included in these stories, but a glimpse at how, the policies and misinformation also influence organ donation as a whole, right? And so we encourage you to keep learning. Like Anissa said, go to wordandblack.com to read the articles, watch the videos. The series, again, is called On Borrowed Time. You can also go to our social media channels. We're on all of them at Word in Black or Word in Black News. And so thank you again to our guests for joining us. Thank you for the Word in Black team for putting this together. And thank you for watching, and we will see you next time.